Welcome back. Let's turn our focus here now. The war in Gaza has been a war on the right to health and underlying determinants of health. So says Dr Tlaleng Mofokeng, the UN Special Rapporteur on the right to health, who was addressing the media at the United Nations in Geneva yesterday. Dr Mofokeng pointed to the healthcare infrastructure in Gaza that's been completely obliterated, as she warned that the overarching right to health had been decimated at every level by Israeli authorities. Now, over 13,000 Palestinians are missing in Gaza, likely trapped under rubble. The death toll is in the excess of 34,000, with almost 80,000 people have been injured or maimed. Now, to unpack more on these issues, Dr Tlaleng Mofokeng joins us now via video link. Dr Mofokeng, thank you so much for your time. I mean, you've accused Israel essentially of systematically working to starve the people of Gaza. Just please expand on how the humanitarian crisis in Gaza continues to deny Palestinians, for one, their right to health, and how the healthcare system in Gaza is on the brink of collapse.
So the current episode that we see unfolding in Gaza represents an acute episode on a chronic issue of an illegal occupation by Israel as an occupying power in the occupied Palestinian territory. And even before October 7th, that was already a situation of a humanitarian crisis that was engineered and, of course, sustained for many, many decades. What we see now is that the health infrastructure has been destroyed. Underlying determinants of health have been threatened, in that starvation and access to food has been weaponized and used as a weapon of war. What we also see is that the health infrastructure in itself and the healthcare workers have been harassed, intimidated, and many of them have reported being tortured. And so all of these are violations under international human rights law, under international humanitarian law.
Now, the shocking and, the stark reality that we are seeing that's also been painted on the ground indicates that even if the fighting in Gaza had to stop now, about 8,000 more people could still die over the next few months due to the public health crisis. I mean, how has this especially impacted on women and children, psychologically especially?
Mental health has been something that has been urgent in terms of psychological first aid in the ways in which this war escalated. The anticipation that people who are still alive of bombs and being killed in itself is a form of violence, because they're living under this anxiety and distress emotionally. People have lost their loved ones. They have not been able to observe their cultural rites of burials. And even in death, there is no dignity for the people and the martyrs in Gaza. The other important thing, of course, to keep in mind is that young people, the children, are already experiencing anxiety, mood disorders, and exhibiting, for all of us, post-traumatic distress syndromes that are very complex. And so when we think about humanitarian aid, we often think about the physical injuries, but often lacking mental health support. And so it's always been my call to remind all of the different humanitarian agencies and UN agencies to still think about mental health in the long term as well, because of new mental health illnesses that will arise from experiencing this trauma as survivors and survivors' guilt, but also the fact that you have young children who for the rest of their lives will be experiencing intergenerational trauma in ways that I don't think we are yet to comprehend the scale and the depth of the violence that they're experiencing.
Let's now look at, the role of the UN and other organs that are of influence. I mean, at the moment, Gaza is facing a severe water and sanitation crisis. Less than 4% of the fresh water is drinkable. We've also been covering the news of a mass grave, at the Khan Yunis hospital. Yet we're also covering that, the US has approved $26 billion in military funding for Israel and about $9 billion for aid. I mean, how important is it that organs like yourselves, the UN, to call out countries like the US directly to stop prioritizing weapons, given the scale of the human suffering there?
This is about understanding the power dynamics in the global architecture and understanding that the current occupation and the ways in which the allies of Israel, including, of course, the United States and European countries, have been perpetuating and enabling imperialism and colonialism to happen. And those systems are inherently in themselves violent. And so how we respond to that is to remind them of their obligations under international human rights law and standards and consensus documents that they all agreed to be held accountable to as the UN member states. And the fact that now you have Israel protected by the United States and also being supported and funded to carry out genocidal acts must horrify all of us. The UN Secretary General should be filled with rage and fury, even at the ways that the UN agencies are unable to perform their mandate on the ground in Gaza, in the ways that our own colleagues at the UN have been killed and targeted in the ways that they were, in the way that UN agencies were defunded based on misinformation, disinformation, and lies, which have been proven to be lies. And so there's a lot to be said about accountability, but I do think that there is a hypocrisy in the global space right now, in the multilateral system, where countries and member states get to choose which human rights and which countries and which people they see as human. And the continued dehumanization of Palestinians is recognized by many of us who know colonial and imperialistic rule, as we have seen how it has happened in Sudan, in South Africa, that continues to happen in Syria, in Yemen, and all of the other areas of contracted conflict.
Very quickly, Dr. Mofokeng, as we wrap up our conversation, of course, you made this plea again for immediate ceasefire, and you also spoke from the position of yourself being, a medical doctor. When you see your colleagues go through what they're going through, I mean, what goes through your mind?
I continue to bear witness to this horror, and I think what makes me the most worried is that health infrastructure and healthcare workers should be protected under international human rights law. And we are the last defense system. And when the practice of medicine and healthcare workers are attacked and killed in this manner, it really opens us up to a very different layer, for me, I think, of violations of human rights. And of course, people justifying that in terms of the current conflict in Gaza. We need to remember always that doctors and nurses are the oath takers. They decided to stay behind even though they knew that death awaits them. They defied those evacuation orders time and time again to be able to respond to the population who needs them the most. And this job is not just noble. This job, it is a calling, but we must make sure that we understand what it takes to be able to do this work and deliver the quality service that people provide. And there must be accountability. The UN must demand accountability, must demand access to Gaza to be able to provide an independent investigation into why is it that so many healthcare workers were killed and targeted and tortured, and many of them in forced disappearance. So it's for me quite sad, and I stand in complete solidarity with my colleagues in Gaza and everywhere in the world in times of conflict and war.
Absolutely, Dr. Mofokeng. Let's leave it there for now. Dr. Tlaleng Mofokeng is the UN Special Rapporteur on the right to health.